Auzubillahi minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Respected Chair, my dear guests and colleagues, Assalamu alaikum wa rahmatullahi wa barakatuhu. It's my great honor and privilege to tell you about the Fazle Umar Hospital strategic planning and listening process that was initiated by beloved Hazur. On October 27th, 2024, our beloved Imam gave a historic address in Islamabad, London, United Kingdom. During that address, he said, "The Medical Association of the Jamaat should consult and proactively engage with relevant officials of the hospital administration and Nazir Sayyid in Rabwa to formulate a comprehensive strategic plan for the short-term and long-term development of Fazle Umar Hospital." Another excerpt from his historic address, he said, "Many Ahmadiyya doctors themselves have expressed their opinion that the Fazle Umar Hospital should be developed into a state-of-the-art facility. Yet, it is not sufficient to merely suggest this. Rather, as doctors and as a medical association, you should be at the vanguard of translating this exploration into a reality. So you should work diligently on this project and send me your proposals." It was after that historic address that AMMA USA, in partnership with medical associations around the world and other colleagues who could support hospital improvement, embarked on the strategic planning process, a 6-step process under the guidance of beloved Hazur and respected Amir Sahib USA was developed, and you can see it on the screen. Step 1 was to form 20 clinical and operational areas for Fazle Umar Hospital with international partners, and we had the great honor and privilege that beloved Hazur himself appointed chairs and vice chairs for each of those 20 teams. Step 2, questionnaires were distributed so we could get an assessment of the current status of the facility. And after our local Rabwa partners filled those questionnaires out, many team meetings occurred where international partners had various discussions to think about the way forward. Step 3, once those discussions about what the plan could be to move forward, one-day departmental meetings occurred where all of the feedback and plans could be discussed in an open and transparent manner. By the grace of Allah, 26 one-day meetings occurred. And step 4, which is where we're at today, those recommendations, and that will be, inshallah, be presented on October 14th through 16th with a hospital-wide meeting. That's step 5. And then step 6, all of these recommendations will be presented to beloved Hazur for his guidance and next steps. This is the strategic planning phase we're currently in, and as I mentioned, this will occur until October, and then it'll be a multi-year implementation plan. There's no question that any plans that will need to be approved will need to be resourced, and specific operational plans would also need to be developed, which would include personnel, equipment, etc. Strategic planning considerations which you received from respected Amir Sahib and beloved Hazur included that all 20 teams have been reminded that the involvement in the Fazle Umar Hospital project is really one of ownership of the project, and in this strategic planning phase where recommendations are being given. But that's not limited to that only. We're asking those same teams to recommit once beloved Hazur's specific approval of the plans is received. The second point is that in areas where there are limitations in human resources or the ability to have center of excellence or areas of expertise for clinical care and no Fazle Umar Hospital staff exists, the teams have been reminded to plan modestly with the intent of participating in Waqf Arzi, perhaps on a rotational basis, to start delivering these services. This is the breakdown that more than 263 volunteers from around the world have said labbaik to the call of Hazrat Khalifatul Masih, Ayatollah bin Nasr al-Aziz, and you can see the country breakdown. 40% of volunteers, and mostly physicians, nurses, healthcare professionals, including IT and other professionals, have volunteered. 40% are from the US. We have approximately in the high 20% from Germany. You can see Canada in the red, Pakistan in the green, and UK and other countries, with the Middle East, Australia, and India. This is a sample scorecard. We had the great benefit of having some of the members who have been part of the leading healthcare consultancies in the United States, and these were borrowed from some of the best practices that are out there. And this scorecard summarizes those recommendations, and you'll be seeing or hearing about this, if you haven't already, over the next few weeks to months. And this scorecard has the short and long-term plans, as well as the top 5 priorities of each team. We're now in the phase of finalizing the scorecards. You can see we should pray for all of these volunteers. There's literally been thousands of hours of work that have already occurred to try to move all these different clinical and operational areas forward. As you can see, these meetings typically occur on a Saturday morning by Zoom worldwide. We do it at a time when the maximum number of participants from around the globe can participate, and so certainly all are welcome to participate in this process. This is the list of the Fazle Umar Hospital coordinators. We should keep them in our specific prayers. We've been working tirelessly for this project in partnership with our international partners. In conclusion, this was the call to action that since that October 27th address, more than 260 dedicated volunteers have said labbaik to the call of Khalifatul Masih through the collaborative efforts of Fazle Umar Hospital staff, and we're very grateful to Brigadier Dabir Sab, who is the administrator of Fazle Umar Hospital, and Nazir Said Sab, Mir Mahmood Ahmed Sab, and all of the Rabwa staff who've been absolutely wonderful in terms of their sincerity and the many, many years of hard work that they've done serving the population in Rabwa and the region. So it's a great honor and privilege for us to be working with them as part of this process. So now we have blended 20 clinical and operational teams, and we invite all healthcare professionals and students. We need students to help us carry this forward, to join this blessed initiative and contribute to beloved Hazur's vision of making Fazle Umar Hospital a genuine center of excellence. I'll end with another excerpt of Hazur's address from October 27th, where Hazur said, "I urge all of you to reflect upon this and consider how you can leverage your skills, expertise, and resources to elevate the Fazle Umar Hospital in a way that it becomes a genuine center of excellence. If you can achieve this objective, you will not only impact the lives of countless individuals today, but will also leave a lasting legacy for generations to come, inshallah." Jazakallah.